So today's session we will discuss about two chapters, chapter 9 and chapter 10, hunger, satiety and eating disorders, and then later we will do picky eater. Okay. So those who have the textbook, it's on page number 93, hunger, satiety and eating disorders. If anyone is joining late, please help them up with the page numbers or topic name. So hunger and satiety, here your hypothalamus is involved to make sure you understand what hunger is. So in the hypothalamus, there are nerve cells that gets activated when you are hungry. Okay, and they produce two main proteins called neuropeptide Y, NPY, and agouti related peptide, AGRP in short. Okay, so these two proteins are NPY and AGRP proteins are produced as soon as you are hungry. Okay, and these two proteins will make sure that uh, once these two proteins are released, they make sure that you feel hungry, the hypothalamus is activated and you eat food. And after you eat food, now you have to stop eating food. So again, two other proteins are released. One is cocaine and amphetamine regulated transcript, CART protein, and then we have melanocyte stimulating hormone, alpha MSH hormone. So these two hormones will come into play once you are satisfied, once your body understands that the hunger has to come down. Okay, so this is a nervous system that is functioning to understand how a person feels hungry and when he or she should stop eating. So hunger, we have different terminologies which we have to see here. So first, what is hunger? Hunger is a normal sensation and it's a desire to eat. And it tells, and when you're hungry, you get the message to the brain that the stomach is empty. Okay, and you will have that stomach growl, you will have hunger pangs. Okay, you will feel that discomfort in your stomach. So in some people, like specifically diabetic and all, you will feel that when they are hungry, they will feel lightheadedness, they will feel like they are fainting or they get very angry. Okay, so partly the hunger mechanism is controlled by hypothalamus, and the other half of it is controlled by your empty stomach, your blood glucose levels, intestine, and certain hormones in the body. They all control the desire to eat food. They all control hunger. So that is what is hunger is. Okay, desire to eat. Fullness, it's a feeling of being satisfied. Okay, once the stomach is full, you are eating food. Once the stomach is full, it has to tell the brain that uh, within it may take at least 20 minutes for this mechanism to happen, when your stomach is telling your brain to stop eating. Okay, normally as soon as your brain gets the message that you have to stop eating, that's when you feel completely full. Again, the moment you feel fullness, that is also partly controlled by hypothalamus, your blood glucose levels. As soon as your blood glucose level rises, your body will get the message that the stomach is full, you have to stop eating. Okay, then appetite. Appetite is a desire for food, especially after seeing, smelling, or even thinking about food. You have a desire to eat food. Okay, so that is appetite. Even after you are full, your stomach is full, you will still have an appetite to keep on eating just for the sake of eating. Okay, and this might happen when you are sick or when you are stressed out. Your appetite may be quite high, you keep on eating. Okay, the body is not able to understand what is fullness and what is the appetite. Satiety, that is a desire to limit further food intake. Okay, this is where you have to completely stop eating food. You're completely full, you can eat anything more. That is satiety. So after you have completed a satisfying meal, you no longer require more food, so you feel satiated. It's the desire to completely stop eating the food because you're completely satisfied, you are full. So, in some people who are undergoing some emotional turmoils or they're undergoing some stress, in them, satiety may be delayed and that could lead to overeating. Okay, satiety may come, but it may come in after some time. So, till that time, you will keep on eating. That leads to overeating. So, here you can see the flow chart of how as soon as the lateral hypothalamus is turned on, you feel hungry, you eat food, your blood glucose level increases, and this increase in the blood glucose level, since the blood is circulating, it reaches the ventromedial hypothalamus. This is another part of the hypothalamus. Lateral hypothalamus, ventromedial hypothalamus, these are the parts of your hypothalamus. When the ventromedial hypothalamus turns on, you feel completely satiated. That is the signal that your body tells to the hypothalamus gives to your body, stop eating food. Okay. So once you feel satiated, you stop eating, and slowly, when the body's glucose level comes down after 2 to 3 hours or so, again the hypothalamus is turned on because the blood is circulating. Low blood glucose has reached the hypothalamus, and the hypothalamus will understand, okay, the blood glucose levels are low. You have to kick on the hunger all over again. So this is the cycle of hunger and satiety that continues with the help of hypothalamus. There are other factors also involved in making you feel hungry and full. Other hormones involved like leptin and ghrelin. We'll see that now. So leptin and ghrelin, these are the two major hormones that regulate your body weight as well as your appetite. Okay, you desire to have food and to desire to stop, okay, to control your body weight. It is these two hormones which play an important role. So ghrelin is a hormone which is secreted by your stomach. Stomach secretes this hormone called ghrelin, and as soon as the ghrelin enters your blood stream, blood circulation, and it reaches the brain with the ghrelin hormone in the blood circulation, when it reaches the hypothalamus or the brain, you get the signal that the stomach is empty and you have to feel hungry. Okay, so it increases the appetite. Ghrelin hormone, it increases the appetite. The opposite of this is what leptin does. Leptin is secreted by your adipose tissue, adipocytes, adipose cells, your fat cells. Okay, fat cells will secrete this leptin hormone. As soon as the leptin hormones are secreted into the bloodstream, your body understands that, okay, a lot of food is there, a lot of blood glucose levels are there. Now you have to stop eating. It decreases your appetite. Leptin hormone decreases the appetite. It is secreted by the adipocytes, your fat tissues. Okay, so in detail, the biochemical part of it and how these hormones function with regards to other receptors and chemicals and other hormones are given in the textbook, but you do not have to study that in detail. You just have to know about what is ghrelin, what is leptin, what is the role of hypothalamus in making you feel hungry and satiated. That's it. Okay, apart from leptin, your insulin also, the circulating insulin also controls your hunger. If there is too much of insulin in the bloodstream, it will negatively affect your satiety. Okay, if there is too less insulin in the bloodstream, you will feel more hungry. So all these hormones, ghrelin, leptin, insulin, okay, they all play an important role in making the body understand when it is hungry, when it has to eat, and when it has to stop eating. Then we come to the hunger and satiety cues. These cues are what we see in children to understand if the child is hungry or if the child is full, feeling full. Since young children cannot vocalize, like infants and toddlers, they cannot vocalize what exactly hunger is or what exactly fullness is. You have to look out for these small cues. Okay, so that you can understand uh, if the child is hungry or full. This is on page number 94 in your pediatric nutrition textbook. So hunger cues, the child will show excitement with food. When you show a food in front of or keep a food in front of the child will show excitement towards it. It will reach out for that food, or it will point, at least point towards that where food is kept. It will use hand gestures or sounds to signify hunger. Okay, like it will take its hand towards its mouth, or it will show towards its stomach. Okay, stomach growling sound you will hear from the child when you hug the child or pick up the child. You will hear this stomach growling sounds and all. Okay, so these are one of few of the hunger cues. They lean towards the food, visually track the food. Their limp will show excitement. As soon as the food is shown, they will try to dance, or they will show excited movements in their limp, in their hands and legs. They will open their mouth as soon as the spoon or feeding hand approaches. And sometimes, usually, if the child is over 18 months of age, they themselves will try to feed themselves from the spoon. Okay, so these are one of the few of the hunger cues. Then we have the satiety cues, or the fullness cues. Here, when the child is completely full, not feeling at all hungry, the child will turn their body away from the food, or they will push the food away, and they will eat the food at a very slow pace. And easily they get distracted by the environmental noises or whatever is happening in the environment. They are focused more on that, not in the food that is in front of them. So these are the cues of satiety. Coming to the eating disorders in toddlers. The first eating disorder is picky eating. In detail, we will study about picky eating in the next class, in the next presentation. What is picky eating? How does it happen? And what causes picky eating? How to manage it? And in some cases, the child may suffer from childhood anorexia, which is rare. Childhood anorexia or toddler anorexia is very rare, but it may happen. Usually, the children who have eating disorders like picky eating, it may turn into anorexia. Okay, in some rare cases. Anorexia and bulimia, these are the diseases which are more common in adults, not that common in infants or toddlers. Then aerophobia, it happens when you're not burping the child. After you have breastfed the child, you have to burp the child. Okay, if the burp has to come out, otherwise the child may suffer from gastritis. Okay, gastroenteritis, gas issues, flatulence issues, distended stomach that could lead to pain. Okay, so that would lead to aerophobia. The child is scared of any gassy food, or scared of any fullness in the stomach at all. Some other issues like underfeeding or overfeeding, it completely depends on how the parents understand the hunger cues and satiety cues. Sometimes, even if the child is hungry, but if the child does not show any excitement, the parents may think that the child is not hungry and may not feed the child much. In some cases, even if the child is showing society cues, or the child is not showing any cues at all, the parents may still go on feeding the child till the child cries, or till the child is in pain. Okay, that lead to obesity. This will lead to obesity as well, overfeeding, etc. Then possetting. Possetting is a small amounts of milk that you have fed the child. It comes out through the mouth. Okay, even if the child's stomach is pressed a little bit, automatically whatever you have fed the child, whatever milk you have given to the child, that comes out of the mouth. Okay, so that is possetting. It's very common. It happens to all children. Then rumination. Rumination is, some children have this habit of uh, children will bring out small quantities of food that they have swallowed back into the mouth. They will chew it and again they will swallow it. Okay, so that is rumination. Maricism is the another name for it. They will eat the food, it will enter the stomach, and because of some regurgitation, because of some malfunctioning in the sphincter, okay, esophageal sphincters, the food will regurgitate back into the mouth. They will eat it and they will again swallow it. Okay, so that is rumination. So these are the common eating disorders which we see in children. And uh, in these conditions, some evaluation, medical evaluation is required, counseling is required. Okay, children may suffer from constipation as well when the food intake is this low. Okay, and too much of cow milk in their feed, in their food, will also lead to constipation. Some food intolerances can lead to loose stools or diarrhea. And usually children who are picky eaters or problematic eaters, when it is meal time, that is the most difficult time of the day for the mother to feed the child. It feels like a war. If it feels like the mothers are going, or the parents are going to a war with the child. Okay, so that is one of the sign of a child having eating disorder. Okay, it feels like wartime to feed the child. It feels like wartime, and sometimes the child will go into hunger strike as well, not eat at all anything, just because out of anger, some irritation or angerness towards the parents, the child may go into hunger strike. Then the developmental stage of eating disorders. So problematic eating behavior, which is common in toddler, it may translate into young children as well. Usually it fades away, but in some cases it may translate into the young children and young adults as well. Okay, when they transition into preschool phase, most of the typical picky eating behaviors will subside, but in some cases it may still stay back. Okay, so preschool children, we have to put them under the Erickson's early childhood development stage. So this is certain some of the early development stages of Erickson's developmental model. Total, there are 8 stages, but the other 4 stages we will not discuss here because that is for teenagers and adults and old age people, midlife adults and old age people. But in this particular chapter, we are just concerned with for the first 3 main stages of Erickson's development. So first stage is the from birth to 18 months of age. Okay, 1.5 year old. Okay, that is the first stage. So here the child has to either develop stress, or the child will develop mistrust towards his caretaker. Okay, so the outcome here should be the child should completely develop trust on their parents. Second stage is the period from 1.5 years to 3 year old. Okay, here autonomy, shame, and doubt develops, early childhood. Okay, they explore the sense of control in every act. They will try to show tantrums. They will want things to be done in their way. They will try to manipulate the adult in their own way. Okay, so this happens in stage 2. So in stage 3, it is initiative versus guilt. This is the preschool stage. This is when the child is exposed to new people. Okay, people from their own age, children, other children from their own age, teachers, Anganwadi teachers. Okay, that is the preschool stage. So they here they will have to face certain challenges and they have to overcome it. For example, to stay away from the parents. Okay, they will cry a lot when the parents drop them in play school or the kindergarten for the first time. Okay, that's a challenging situation for the child to stay away from the parents, that they only trust the parents. The trust has developed only with the parents and the family members. Okay, they don't trust other people yet. So that's a challenge that these kids have to overcome. First few days they will cry, and slowly they will understand this is a norm, this is the new norm, and they have to follow it. Okay, so facing challenges and overcoming them is the third stage. In fourth stage, it is industry versus inferiority. Okay, that does not come under this particular chapter. Okay, but here the child has overcome certain initial challenges of meeting new people, but now the child is enthusiastic about making new connections, making new friendships, okay, social interactions. Child is excited about it in the stage 4. Okay, so these are the first three stages in which uh, e- whatever eating disorder has developed in stage 1 and stage 2, usually it should subside by stage 3. Okay, that is what Erickson here tries to tell us. And picky eating is very common among majority of the children in this phase of development, and it does not usually cause any significant health issues. But if it continues over a period of time, and if it has translated into other development stage as well, that could lead to some health issues or nutritional issues. So pathogenesis of picky eating, how it affects the health. Certain people have this super taster theory in which they claim that picky eating children, they are born in this way, that they are genetic super tasters, which means they have too much of taste buds in their on their tongue. Okay, that is the reason why they can't tolerate many of the strong flavors, or they do not want to try lot many strong flavors. So according to this, about 25 percentage of our population has more taste buds than the rest of the general population. Okay, this is what the study will tell. So if whoever comes under this super taster category, whichever child is born under the super taster category, they will have at least 1,100 taste buds per square centimeter. Okay, otherwise the normal people have much less taste buds per square centimeter of the tongue. Okay, so specifically the super tasters who have these many extra taste buds on their tongue, they will find fruits, vegetables like grapes, broccoli, cabbage, cauliflower, they find it intolerable because they have a strong pungent taste to it. Okay, and bitter things they will completely avoid it at all cost. Okay, so children are usually the super tasters because whatever taste buds they had in initial days of their childhood, during infancy, toddlerhood, it usually subsides, it or usually decreases when they grow up. So when they grow up, they don't become a picky eater, they eat majority of the food. But during childhood, when they are considered to be super tasters, when they have too many taste buds, very few children who are blessed with too many taste buds on their tongue, they will definitely feel aversion towards any strong flavors. Then slow growth rate. Children who belong to this toddler age group, who are picky eaters, they tend to grow very slowly, more slowly as compared to other children who are in the same stage of development. And this is the reason why we call it as a physiological anorexia, because the child is not eating a variety of nutrients. The child only wants the same food on a daily basis. So that leads to physiological anorexia. Then emotional state and mood swings, they are mood changes in the toddlers are very quick. Okay, in a very quick phase the mood changes happen. So this could affect their eating habits as well, and their decision making habits as well. What to eat, what not to eat, why should I eat now? uh, these kind of questions will come from the toddler because of their mood swings. Then parental influence. Usually, children pick their eating habits by mimicking what their parents do. So, if the parents are a picky eater or the parents eat only a limited variety of food, the child will also tend to follow the same thing. Okay, so at least in front of the child, the parents has to consume a variety of food so that the child mimics that habit as well. Then we have neophobia or slow adaptation. Neophobia means any you have a fear of new items, specifically food neophobia, fear towards new food that is being offered. Okay, so whenever you are trying to give something very new for to the child for the first time, expose the child to this new food at least for 10 to 15 times. Don't give up. At least for 10 to 15 times, if you have repeatedly exposed the same food on different occasions only, and still the child does not want it, then you can completely avoid it. But do not give up. At least 10 to 15 times, the child should be exposed to this new food. Even if the child rejects or accepts later, the exposure of 10 to 15 times of the same food again and again should be there. Then we have the genetic and environmental influences. Certain clinical findings show that eating disorders are genetically based as well. Okay, if the parents have suffered the same eating disorders, it is known that the child may also tend to develop the same later on. So parents of infants who had bulimia nervosa or disturbed eating pattern or anorexia nervosa at any point of their time, high chances are there the children born will also be picky eaters. Common eating disorders, infantile anorexia is very rare, but it can happen. Infantile anorexia can happen. Okay. The child completely avoids food, does not like the smell, taste of food, any food for that matter. Breast milk is something that the child may prefer, but all the other form of solid food, pureed food, okay, the child usually tends to avoid it. Then picky eating, we will discuss that in the next presentation. Sensory food aversion. So here what happens is that the child does not like specific texture, smell or sight of food. Okay, the child will show aversion towards certain sight, smell or texture of food. It like the child is vomiting or the child is feeling nauseated, they will turn their face away from the food that is of a different texture. Okay, they prefer only specific food textures like mayonnaise. Okay, some children like the texture of mayonnaise. They want mayonnaise on everything, even with rice, chapati, everything they want mayonnaise. Okay, they like the texture of mayonnaise. Anything else that is crunchy or slimy or watery you give, okay, which is separate from the texture of mayonnaise, they will not like it. They struggle with messy meals, they or messy playtime a lot. They strongly prefer certain colors and certain textures and flavors. Anything different you give them, they will not eat it. Okay, and if you give them something different, they will not swallow it. They will put it in their mouth and keep it behind their teeth, between their cheek. They will not swallow it. Okay, and they overstuff their mouth and keep it like that. They will not swallow it. So these are the sensitivities that they show. The children who have sensory food aversion, they will show all this behavior. So how do you have to manage these kids? Do not pressure to taste new items. Instead, try to add new food in the form of play. Okay, in the treat a food like a toy. Introduce a new food like a toy as a form of play. Okay, use new food to play with and encourage the child to play with this new food. Blow bubbles into the new food like that. Okay, and if possible, use electric toothbrush brush so that the child's oral sensitivity is heightened. Okay, and explore sequential feeding therapy, which means introduce one food at a time. Okay, don't introduce too many new items in the same day. Okay, one food at a time. Repeatedly expose this new food again and again, and then bring about the second food. And if it gets worsened, if the sensory food aversion is getting stronger day by day, you have to consult a pathologist or a doctor or a pediatrician for a medical management for the case. Then post-traumatic feeding disorder, it happens in children who have undergone choking hazard. Okay, if they have swallowed something and it went into a choking hazard, you have to give the child Braxton Hicks, something like that, and the child has to spit the whatever was choking the child, it has to come out. Okay, this becomes a traumatic incident for the child. The child will remember this incident. Okay, the airway is blocked, the child is not able to breathe, the parents are getting worried, and somebody's pressing the child, okay, so that whatever is choking this child is getting out. Somebody must have put their fingers inside the child's mouth to bring out what is choking them. Okay, so that becomes a traumatic situation for the children. And after this, what happens is that whatever textured food had caused this choking hazard, the child will completely avoid it. Okay, they will not eat solid food at all. They will be so scared of solid food. They will think that all the solid food is out there to get them, all the solid food is out there to give them a choking hazard. So they will stay away from solid food. They will only have smoothies, some liquid food, semi liquid food. Okay, so that becomes a post traumatic feeding disorder. Then disruptive mealtime behavior. This is like a war zone during mealtime for parents, specifically who are dealing with picky eaters. As soon as it is mealtime, the child was completely calm, quiet, happy, or playing around. But as soon as it is mealtime, you bring the child to feed the child will show tantrums, will cry a lot, okay, throw things, show all negative behavior in the mealtime or at the dinner table. Okay, that is disruptive mealtime behavior. So that is also a sign of eating disorder or picky eating. Suboptimal growth, the child may not be able to achieve proper growth as compared to their peers who are not picky eaters. Okay, some height differences, weight differences. Okay, more than 5% difference in the height or weight is seen with picky eaters. And then pica can happen, in which it is a psychological disorder in which the child will have an appetite for unlikely substances like chalk, ice, hair, paper, dry wall paint, okay, sharp objects, metals, stones, soil, mud, glass, feces, raw rice, okay. So, like all these are some certain examples they have given in the textbook. So the child will try to eat all these things, okay, not the food. Usually, it is associated with some of the deficiencies, some mineral deficiencies, lead poisoning. Okay, it is associated with this. A certain micro mineral malnourishment, okay, or deficiencies are associated with pica. So that has to be corrected. When you correct the deficiencies, automatically pica will also subside. So coming to the management, how to manage the kids who have eating disorders, the toddlers who have eating disorders. Avoid all forms of distractions or noise while you are feeding the child. Okay, it has to be an environment in which the child, the parent who is feeding, and the food. Okay, this should be the main parties in the environment. Nothing else. Not no smartphone, no TV. Okay, no games. Okay, no PlayStation. Nothing should be there. So avoid such distractions. Use a high chair at the table for the child to sit, because that will enable the child to see what the parents are eating, what others are eating. Okay, and the child becomes very familiarized to new food when the child is at a high chair, because the child is seeing what the mother is cooking, what the father is eating. Okay, feed the child at an interval of 3 to 4 hours so that the child becomes hungry in that interval, and you can use that hunger to add new food or add more food into the child's tummy. Avoid snacks, beverages in between the meal time. Otherwise, if the child's stomach is full because of snacks and beverages, the main meals will be missed out. Mealtime should not be more than 20 to 30 minutes. If that meal time is taking more than 20 to 30 minutes to feed the child, there are high chances that the child is a picky eater. Always serve age appropriate food in form of puree, in form of soups, or in form of finger foods, small pieces, small servings. Okay, it should be age appropriate. Small sizes of meal. Do not overwhelm the child with too much of portion sizes, too big portion sizes. Go for small portion sizes that are easy for the child to look at, eat, play with, and eat. Okay, not to create a big mess. If you give big portion size, the child will create a mess out of it, throw some of the food here and there. Small portion sizes are well handled by the children. Okay, it's less messy as well. Introduce new food one at a time, step by step, and repeatedly show this new food items at least 5 to 15 times before you give up. Don't give up the first day when you show a new food, the child rejects it. Okay, don't give up that soon. At least 5 to 15 times you have to show the child the same food repeatedly over and over again. And if the child still does not agree to try it, then you can give up. Okay, otherwise, at least 15 times expose the child to the same food again and again until and unless they accept it. Then independent feeding. You have to encourage the child to use their own spoon, specifically if the child is above 1 year old. Okay, uh, uh, be, encourage them to be independent and use their own plate, use their own cup, mug, spoon, fork to eat. Okay, and allow age appropriate messes. Children will be messy. Do not scold them or do not um, make mealtime a fearful situation for the child that the parents may scold if things get messy. Okay, any form of mess which is age appropriate mess is okay. You do not have to be tough on the child. And don't try to over wipe the children's mouth with napkin after every bite. Okay, at the end of the entire feeding procedure, then you can give a nice wash to the child. So these are the management aspects of improving a feeding disorders.